Mastering NCLEX Lab Values, your ultimate guide. Hey everyone, and welcome back to my channel. I know you're all working hard to conquer the NCLEX, and today I'm here to help you tackle one of the most important topics, lab values. Interpreting lab values is a fundamental nursing skill, and trust me, it's a high yield topic on the NCLEX. Hello, I am Miriam, your nurse educator, and in this video we're going to break down the most critical lab values you'll encounter on the NCLEX. Complete blood count, CBC, unlocking the secrets of your blood. Let's kick things off with the complete blood count, also known as the CBC. This panel of tests is like a window into your patient's overall health. It tells us about their infection status, if they might be anemic, and even how well their blood clots. Now, when we talk about the CBC, we're talking about key players like white blood cells, hemoglobin, hematocrit, and platelets. First up, we've got our white blood cells, those brave soldiers fighting off infections. A normal range for WBCs is typically between 4,500 and 11,000 cells per microliter. Next, we've got hemoglobin, the workhorse responsible for carrying oxygen throughout the body. For men, a normal hemoglobin level is around 13.5 to 17.5 grams per deciliter, while for women, it's 12 to 15.5 grams per deciliter. Hematocrit goes hand in hand with hemoglobin. It tells us the percentage of red blood cells in the blood. And finally, we can't forget about platelets, those tiny cells that help our blood clot. Basic metabolic panel, BMP, electrolytes, the body's electrical system. The basic metabolic panel, or BMP, gives us a snapshot of electrolytes, kidney function, and blood sugar levels. Electrolytes like sodium, potassium, calcium, magnesium, and chloride are essential for fluid balance, nerve function, and muscle contractions. Sodium is the most abundant electrolyte in our blood. Normal sodium levels range from 135 to 145 milliequivalents per liter. Potassium, crucial for heart rhythm, ranges from 3.5 to 5 milliequivalents per liter. Calcium keeps our bones strong and aids in muscle function and blood clotting. Normal calcium levels range from 8.5 to 10.5 milligrams per deciliter. Magnesium, ranging from 1.5 to 2.5 milliequivalents per liter, is key for muscle and nerve function. Chloride helps maintain the body's fluid balance. Glucose is the body's primary energy source. Fasting blood sugar levels should be between 70 and 100 milligrams per deciliter. Burn and creatinine levels indicate kidney function. Now let's take a deep breath and dive into the world of arterial blood gases, also known as ABGs. These tests are crucial for understanding our patient's respiratory status and their acid-base balance. When we talk about ABGs, we're talking about four key players: pH, PaCO2, HCO3, and PaO2. First up, we have pH, which tells us how acidic or alkaline our blood is. A normal pH level should be slightly alkaline, falling between 7.35 and 7.45. Next, we have PaCO2, which stands for partial pressure of carbon dioxide in the blood. This value tells us how well our patients are removing carbon dioxide, a waste product of metabolism. A normal PaCO2 level ranges from 35 to 45 millimeters of mercury. Now, let's talk about HCO3 or bicarbonate, which acts as a buffer to help neutralize acids in the blood. A normal HCO3 level falls between 22 and 26 milliequivalents per liter. Finally, we have PaO2, which stands for the partial pressure of oxygen in the blood. A normal PaO2 level is typically between 80 and 100 millimeters of mercury. By mastering these values, you'll be well equipped to assess your patient's respiratory and acid-base status. Now let's shift gears and talk about coagulation studies, those crucial tests that help us assess a patient's risk of bleeding or clotting. These tests are especially important for patients on blood thinners or those with liver problems. When we talk about coagulation studies, 4 key players come to mind: prothrombin time, PT, international normalized ratio, INR, activated partial thromboplastin time, APTT, and D-dimer. First up, we have prothrombin time or PT, which measures how long it takes for blood to clot. A normal PT typically falls between 11 and 13.5 seconds. Next, we have the International Normalized Ratio, or INR, which is often used alongside PT to monitor patients taking warfarin. For patients on warfarin therapy, a therapeutic INR typically falls between 2 and 3, depending on the reason for anticoagulation. Now, let's move on to activated partial thromboplastin time, or APTT, which also measures the time it takes for blood to clot. A normal APTT typically ranges from 25 to 35 seconds. Finally, we have D-dimer, a test that measures the breakdown products of fibrin, a protein involved in blood clotting. In this section, we'll delve into the world of liver function tests, also known as LFTs. These tests are like a report card for the liver, giving us insights into its health and how well it's performing its many vital functions. When we talk about LFTs, a few key players come to mind: alanine aminotransferase, ALT, aspartate aminotransferase AST, and bilirubin. First up, we have ALT, an enzyme found primarily in the liver. When liver cells are damaged, ALT leaks into the bloodstream, causing elevated levels. Next, we have AST, another enzyme found in the liver, as well as in other tissues like the heart and muscles. Like ALT, AST levels rise when the liver is damaged. Now, let's talk about bilirubin, a yellowish pigment produced during the breakdown of red blood cells. The liver is responsible for processing and removing bilirubin from the body. Congratulations, future nurses. You've just taken a crash course in some of the most important lab values you'll encounter on the NCLEX and throughout your nursing careers. Remember, lab values are a cornerstone of nursing practice. By memorizing those normal ranges, becoming pros at spotting any abnormal values, and knowing the right nursing actions to take, you'll be more than ready to answer those NCLEX questions with confidence. You've got this. To help you even more on your NCLEX journey, I've created a free study guide packed with even more tips and tricks to conquer those lab values. Download our free NCLEX study guide at nursecareerblueprint.com. Subscribe to our channel for more NCLEX tips and nursing education videos. See you in the next one.